Hello everyone. In today's session, we'll be learning about the mid-sagittal section of the head and neck. So here we can see two different specimen. Okay, this is the mid-sagittal section of the head and neck, right side that we can see. Okay, and this is the mid-sagittal section of the head and neck, left side. Okay, both are similar specimens. Just the difference is that in this specimen, the brain part has been removed. Okay, otherwise most of them are similar. Okay, so let's try to identify all important things that are seen in this specimen. Okay, so let's start with this one. So in the mid-sagittal section, we can see this is the skull, okay, and here we can see this is the falx cerebri, okay. There is falx cerebri which is present between the two cerebral hemispheres, okay. And when we just try to reflect this falx cerebri, we'll be able to see the medial surface of the cerebrum, okay. Then this structure is corpus callosum, okay. This connects the two cerebral hemispheres. Then there is a midline septum which is seen here beneath the corpus callosum. This is referred to as septum pellucidum. Okay, and this is the part of the thalamus. Okay, thalamus as well as the hypothalamus. And then here we can see the part of the brain stem. Okay, the midbrain, pons, and medulla oblongata. And this is the cerebellum. Okay, then falx cerebri, as we can see, it is a sickle-shaped fold of the dura mater. Okay, anteriorly it extends up to the crista galli. Okay, there's a bony projection here. Posteriorly it is broad, which is seen at the level of the tentorium cerebelli. Okay, this is the tentorium cerebelli. Okay, and there are multiple venous sinuses enclosed here. At the upper part of this falx cerebri, there is superior sagittal sinus. At the lower margin, there is inferior sagittal sinus. Okay, here there is straight sinus. In the lower part here, there is occipital sinus, and there is one area here called as confluence of the sinuses where multiple dural venous sinuses meet. Okay, then we can see here this space. This is the sphenoidal air sinus. Okay, there is a large air cavity which is seen here. This sphenoidal air sinus, one of the paranasal air sinuses. Then this is the frontal air sinus, the cavity which we can see in the frontal bone. Okay, so these are the two paranasal air sinuses, and other two are there. In this region there is one ethmoidal air sinus, and just underneath the maxilla bone here there is maxillary air sinus. Okay, so these are the four paranasal air sinuses that you need to know. Okay, in this specimen also it is seen very clearly. Okay, this is the sphenoidal air sinus, this is the frontal air sinus. Okay, and here folds of dura mater are also very clear. This fold of dura mater that we can see, that is the tentorium cerebelli. Then let's come in this region. This is the nasal septum. Okay, this is the nasal septum, and then this is the lateral wall of the nose. Okay, so nose has got multiple components like the nasal septum to lateral wall and the cavity. Okay, the space that we can see here, that's the nasal cavity. So in the lateral wall of the nose there are concha and meatus. Okay, so this concha that we can see, this is the middle concha beneath which there is a space called as middle meatus. Similarly, there is one above called as superior concha, and this is the inferior concha beneath which there is inferior meatus. Okay, this concha and meatus, these are projections in the lateral wall of the nose, and the meatus has got openings of the paranasal air sinuses that we learnt. Okay, and this nasal septum, this is the posterior margin of the nasal septum here, the posterior opening towards the nose, that is referred to as coena. Okay, then let's come down. So here we can see the bone which is referred to as hard palate, behind which there is the soft palate. Okay, then this cavity here is referred to as the oral cavity. Okay, and this is the tongue. Okay, so a large muscular organ which is seen covered by mucosa. Okay, that's the tongue covered by the mucosa. Okay, and this is the cut section of a bone. This is mandible. Okay, and here we can see the lips, the upper lip, the lower lip. Okay, the muscles which we can see inside the lip region, that's the orbicularis oris muscle. Okay, then as we come down here, we can see this is the larynx part, this is epiglottis. Then there is a cartilage here called as a thyroid cartilage. Then there is the cricoid cartilage. Okay, then larynx continues as the trachea. Okay, and then here this part is the pharynx. The upper part is the nasopharynx, middle part is oropharynx, and at the level of larynx is laryngopharynx. Okay, so nasopharynx is opposite the first cervical vertebrae, atlas, okay, and oropharynx is opposite the second and the third cervical vertebrae, and laryngopharynx is at opposite the fourth, fifth, and the sixth cervical vertebrae, okay. And nasopharynx has got one important opening that is referred to as auditory tube, also referred to as pharyngotympanic tube, which opens in the nasopharynx, okay. So from here it is connected to the middle ear, okay. Middle ear cavity is referred to as tympanic cavity, which opens at the nasopharynx, okay. Then tongue, we can see specific two different parts. There is an anterior 2/3 of the tongue, there is a posterior 1/3 of the tongue, separated by sulcus terminalis, okay. And there is some rough elevation that is seen here, that is referred to as lingual tonsil, okay. So tonsils, there is a ring of lymphoid tissue which is present here. So this one is lingual tonsil. There is one area here called as the tonsillar fossa, where the palatine tonsil is located, okay. Palatine tonsil is bounded by palatoglossal fold on the anterior aspect, palatopharyngeal fold on the posterior aspect, and this fossa is referred to as tonsillar fossa, okay. Then at near the opening of the eustachian tube or the auditory tube, there is tubal tonsil, and at the posterior aspect of the nasopharynx, there is nasopharyngeal tonsil, okay. When it gets enlarged, it is referred to as adenoids, okay. So this eustachian tube opening is very important in nasopharynx, and in oropharynx this tonsillar fossa is important, okay. And as we see, this is the esophagus. So anteriorly struck here, behind is the esophagus. We can see cut part of one artery, that would be the arch of aorta, that is arching, and it has been seen in a section, okay. And here we can see the cervical vertebrae. Behind the cervical vertebrae is the spinal cord, okay, which is covered by the dura mater, arachnoid mater, pia mater. The meninges, which covers the brain, also covers the spinal cord. And here we can see the spinous process of the vertebrae, behind which there is the lot of muscles are seen here, okay, neck muscles, okay. So there is a lot of soft tissue present posteriorly as well as anteriorly. If we see the neck region, okay, here is the vertebra. Behind the vertebra and anterior to the vertebra, if you see, there is an equal amount of soft tissue which is seen, okay. So similar things are seen in this section also, and in this section the nasal septum part is still intact, okay. So once we remove this nasal septum, then we'll be able to see the lateral wall of the nose very clear, okay. And one more thing I wanted to discuss was the ventricles of the brain, okay. So there is one cavity deep to this septum pellucidum. So here there is the cavity of the lateral ventricle, okay. Lateral ventricle, it opens into the, so if I just put the forceps here inside, okay, the forceps is going into a cavity called as lateral ventricle, from which it communicates in an area called as the third ventricle, and from there is an aqueduct of Sylvius which passes through the midbrain and comes into an area called as the fourth ventricle, okay. This is the area of fourth ventricle, okay. This section is not exactly in the midline, that's why this cavity is not very clear, okay. And one artery is seen here. Which artery would it be? And you'll guess this is the vertebral artery, okay. Two vertebral arteries unite to form basilar artery in front of the pons, okay. So like this, you should be able to identify all major structures seen in the mid-sagittal section of the head and neck, okay. Thank you.